Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, our topic is food insecurity among adolescents. I speak with Kristen Mari, an adolescent health researcher at Johns Hopkins, about why not having enough to eat uniquely impacts young people, and a recent study that suggests that programs meant to combat food insecurity aren't meeting the needs of adolescents. We also talk about the false claims of policymakers that such programs are unnecessary in light of childhood obesity. Let's listen. Kristen Mari, thank you so much for being on Public Health on Call. Today, we're talking about food insecurity, particularly among adolescents. So just to start us off, can you tell us about food insecurity?
Yeah, I'd be happy to. So first, we define food insecurity by saying that it's when a person lacks access to healthy food or nutritious food for normal growth and development. And this may be caused by either unavailability of food or a lack of resources to obtain food. And there's different levels of food insecurity. So you can be moderately food insecure to more severe food insecure. So there's different levels depending on need. In terms of when someone is severely food insecure, that basically means that that person has maybe not eaten for the whole day. So they're basically what we would call hungry. They're facing hunger. But even those that have moderate food insecurity, there's still some worries because that means they may be having to sacrifice some things to try to get food, or they're also maybe not getting the best nutritional food. So as you may know, things that are highly processed are usually cheaper. And so a lot of that means that there maybe just have access to those less nutritious foods to get.
And how common is this in the US?
It's very common in low-income households. Among adolescents, it hasn't been researched as much as compared to with adults or children. But estimates are that it's very high, but it's so hidden. When I first looked into this I think it's been about 4 or 5 years ago, it was largely unknown among adolescents. And then when we started interviewing adolescents in Baltimore, it was very common. In fact, just in our small sample, 53% were food insecure, and a third of those were severely food insecure. So it's something, though, among adolescents, when we were talking to them, that they don't like to discuss. In fact, many adolescents told them that admitting that they're hungry or food insecure is almost the worst thing that they can admit.
And just so we have an idea, can you give us an age range for what you're defining adolescents as?
Sure. Yeah. So adolescents, in our study, we looked at 14 to 18-year-olds, but there has been some other studies that have looked at the full range. So adolescents is typically 10 to 19-year-olds as defined by the World Health Organization. But we have found, though, in some of the more recent articles that the older an adolescent is, the more likely they are to be food insecure among children that have food insecurity issues.
And you mentioned before that there's research about adults and there's research about children younger than 10. Why does food insecurity uniquely impact adolescents?
Yeah, well, we often think that adolescence, first of all, is a very healthy stage. So adolescence typically doesn't come to our minds when we're talking about this. But the reason why it hits adolescents differently is because they're in a very critical period of development where they're actively growing, their brains are expanding, their metabolic rates there's all kinds of changes that are happening to their bodies. And it's at this moment where their need for higher calories is also happening. And this often doesn't get thought of in terms of the whole food insecurity issue. When we talk about food assistance programs, we typically think of families with younger children. A lot of the food pantries are geared to them. But adolescents typically don't think of their faces in terms of food insecurity. And it's interesting why we don't, because if we think now, there's been some recent research that has showed that food insecurity is actually linked to a number of behavioral problems, to learning, academic achievement. And so if you can imagine adolescents who are in school and they don't have their normal requirements of caloric need, their learning is going to be impacted. And this impacts on a wide variety of different health outcomes as well.
Can you talk about some of those other health outcomes? Because I think that's important for people to understand the long-standing ramifications of this.
Exactly. Yeah. So there's been studies now that have linked adolescent food insecurity, like I said, with academic achievement, with cognitive decline, with even linkages to obesity, with diabetes, and then other types of things like substance use and even sexual risk behaviors. So the study that we did a few years ago was it was more of a mixed method study, but we conducted focus groups among adolescents. And one of the things that was so heartbreaking to hear about is that in every location that we did these focus groups, we selected 6 neighborhoods in Baltimore. Girls described having to engage in transactional sex to get money to pay for food. And it was very common. That was in every single neighborhood. Boys, meanwhile, would engage in basically what they said anything. So if you think of the squeegee kids, a lot of them mentioned doing that to get money for food because it was easier for them to get money to buy the food rather than to go into some of these places like food pantries where they were often judged and people didn't really essentially want to see them there.
And the squeegee kids, you mean the youths that are out on the corners offering to clean your car?
The youth that are washing windows with on the corners, yes, they got a lot of press on that. But if you think of what they're going through, that may be their only means to try to get food.
And I want to ask, because there are these federal programs, there's what they call SNAP benefits. Why is this age group left out of the systems that are built to address food insecurity?
Yeah, that's a great question. And there are a number of reasons behind that. I think for one, we have to look at how the SNAP benefits are calculated. And in a family, they're tied to the USDA's Thrifty Food Plan, which basically means that for a family of 4, consisting of a man and a woman ages 20 to 60, and then a child ages 6 to 8, and another child ages 9 to 11, they account for what would be a nutritious meal at a minimal price for those 4 individuals in a family. But what that doesn't include is then if you have an adolescent over that age that need a higher level of calories, that level of food then or a level of allotment isn't going to reach the needs for that adolescent children. So that's one thing. The other thing is that the benefits go to the head of the household. And in many of these low-income households, while adolescents aren't called the head of the household, they are actually the ones that are responsible for many of the family food needs. So many of the adolescents that we spoke to and we interviewed were having to go get food and to shop food, but yet they don't have the benefits that come with these SNAP cards. It's rare that they get these EBT cards from the household head that they can use to purchase the food. So then it comes onto them without these benefits, really, essentially.
So you did this study of groups within Baltimore. Tell us a little bit more about what you found.
Yeah. So just recently, during the COVID pandemic, we conducted a study to look at the impact of these federal food assistance programs because there were a number of changes that happened during COVID to help alleviate some of these economic costs that were abnormal during the pandemic because a lot of people were losing jobs and everything. We ended up looking at 3 different types of federal food assistance programs during the pandemic. And the first was the SNAP benefits had increased to the highest amount possible during the pandemic. And then there was a new program called the Pandemic EBT, so PEBT, that was given to account for the loss of school meals. So that was given to families, any family in Baltimore that had a child in school. We also looked at Summer SNAP, which was our original idea for doing this study. So Baltimore City actually contacted us to look to, first of all, evaluate Summer SNAP, it's a program that has been implemented before for children to account for the loss of meals during the summer when school's out. And it had shown some success among young children, but Baltimore City wanted to do this among adolescents to see if particularly adolescents would benefit. But because of the pandemic, we couldn't just look at Summer SNAP. So we looked at each of these programs both separately and then combined to see if it did anything to reduce adolescent food insecurity. So, how we did this then is we worked with the Mayor's Office of Employment Development and Support Services in Baltimore City. And through a data sharing agreement, we got adolescents who applied to the Youth Works program, which is Baltimore City's largest summer employment program. Any adolescent then that was living in a SNAP eligible household was put in this database that was shared with us. So from that database, then we were able to recruit adolescents. We ended up recruiting 284 adolescents, which was quite something because, again, this was through the pandemic. So everything had to be online. But basically, in a nutshell, what we found is there really was no association between adolescents who lived in these households, which received this additional benefits, and food insecurity. And there's been other studies that have shown similar types of things, especially for adolescents with these programs. So I think what that suggests is that, first of all, I don't think that these benefits, like I said before, are reaching the needs of adolescents. And so before, another part of this study, we did some qualitative interviews to ask adolescents themselves what they think they need to be able to deal with food insecurity. I mean, there was different things, but I think the most common answer was that they felt that first, the SNAP benefits need to increase. But then also many of the adolescents felt that they should be given the benefits directly. And so consequently, though, we did talk with other policymakers and they didn't feel that that would go over well. Who knows what's going on in their mindsets? We often think of adolescents not being, the most responsible. That's the typical stereotype. But in fact, like I said before, these are adolescents that are in many ways the most responsible in their households for getting food. So I think there is kind of that misconception out there.
Yeah, I was reading that there are legislators across the US that are cutting these programs. One of them cited childhood obesity as a reason to not give people access to programs that might help alleviate food insecurity. What do you have to say about that?
Well, first of all, like I said before, there's actually a link between food insecurity and obesity. I think there needs to be more research to look at that. But if you think about even those with moderate food insecurity, they're having to make sacrifices of where to get food and purchase food. And we all know that healthy food, it's much more expensive, especially in these low-income neighborhoods. So it's no wonder then if their only choices are these high processed foods where there may be an obesity link. So I don't think that really, if anything, that exemplifies the problem even more. So I think that we actually did have some discussions a few years ago with some Maryland lawmakers about this issue. And it was interesting to me at the time, even that, again, many of them did not think of adolescents to be even associated with this issue. I think the face of food insecurity is mainly among adults and young children in this country. And so I think many don't realize the responsibilities that many adolescents have in these low-income households.
So I want to close out our conversation by asking, you've mentioned the adolescents themselves would like to have more autonomy in this. They could make good use of the SNAP benefits. Are there other opportunities for solutions here?
We're actually trying to think through some of these things. So one of my colleagues, Caitlin Harper here, has been working with young people in Baltimore about this issue. And they have been implementing an online food pantry where adolescents can actually go into a digital food pantry and purchase foods that way. Another thing that we're thinking of trying is going through Instacart, where we can load up like a card, like almost like a SNAP benefit card, and they go into Instacart and they can choose foods that way. And so we'd like to do a study to see if we do this with adolescents, do they purchase healthy food? What do they purchase? How often do they use it? And ultimately, does it actually reduce their food insecurity? So those are some of the things that we're thinking about, but I think there's more than that. There's things in the neighborhood where you live makes a big difference in terms of accessing food and safety issues. I'm also really interested in community gardening and urban farming and kind of the relationship of where those places are in relation to where adolescents live. So I think there's a number of things that should be looked at and examined. I think we're just beginning to think about this right now. And young people are the ones that are the most informative because they know what works best for them. So listening to them and having them tell us is our approach right now that we're taking.
Well, it sounds like your research has really highlighted a population that might have been invisible to those that are studying food insecurity. So, thank you, Kristen Murray, for being on the podcast. We've so appreciated your time and we'll continue to follow your research.
It's absolutely been a pleasure. So, thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.